Amputations are a leading factor in malpractice suits against podiatrists. So how do you reduce the risk that a complication will result in amputation? And if amputation becomes necessary, how do you reduce the risk of a lawsuit? Many patients who end up with an amputation have multiple comorbidities, such as diabetes and vascular disease. These conditions lead to non-healing or infected wounds. A post-operative surgical complication, injury, or other factor can also lead to amputation. Whatever the cause, amputation significantly impacts the patient's quality of life. Effective management means addressing the patient's condition and the potential for complications before they occur. Recognizing complications when they do occur and responding appropriately is just as critical. Start by obtaining and documenting an appropriate history and physical exam before treatment begins. Does the patient have other conditions that need co-management with specialists? Do they have risk factors for a potential complication? Is their hypertension or diabetes under control? Do not just take the patient's word that all is well. Consider obtaining copies of their lab work and other physicians' records. Document the patient's social history. It is extremely important for identifying potential risks and determining the best course of treatment. Does the patient smoke? Can they comply with instructions? Do they have adequate support at home? Can they afford to be off work for an extended period? Are they caring for small children or aging parents? Document both normal and abnormal physical exam findings. If abnormal findings are present, document your rationale for referring or not referring for further evaluation. Collaborating with vascular, cardiology, infectious disease, endocrinology, and other specialists reduces the risk of complications and improves outcomes. Patient and family education is key to reducing the risk of complications that lead to amputation. Explain the patient's condition, treatment options, and risk factors. Explain why you are referring them for further testing. Explain the importance of following instructions and what may happen if they do not. Make sure the patient holds realistic expectations about treatment and its outcome. Document all patient education and instructions in the record. This is a valuable risk reduction tool if a lawsuit is filed. You may have properly informed your patient, but if it is not documented, it becomes your word against theirs. If you are performing surgery, document your medical justification, procedure options, and your rationale for selection. Then obtain the patient's written informed consent. Recognize a complication the moment it arises. Is a wound not healing as expected? Is there a loss of vascularity? Is an infection not responding to antibiotics? Promptly document the abnormal findings and inform the patient. Document your rationale for addressing the complication. Assess and document the patient's compliance with instructions. Documented noncompliance is another valuable tool in the event of litigation. If the patient is noncompliant, work with them and their family to address the reasons. Inform them of the risks, including the risk of amputation. Promptly refer them to an appropriate specialist for further workup if needed. Should a patient eventually undergo an amputation, your documentation matters. Assessments, treatment rationale, patient education, and prompt response to complications reduce the likelihood a lawsuit will be filed. And if one is filed, that documentation will greatly aid your defense. For more information about reducing the risk of complications resulting in amputation, visit our website to read the full blog.